Okay, this is Damian McNamara, Global Medical News Network, and with me is Dr. Vulcain, who is Assistant Professor of Family Medicine and with the Haiti Project at the Department of Family Medicine and Community Health at the University of Miami Miller School of Medicine in South Florida. Now, I understand you were in Haiti at the time of the earthquake. Can you tell me what the first couple of days were like?
I was lying in bed in a hotel room, and it's a one-story place, and basically, thanks God there was no concrete. There was no concrete roof. It was more shingle type of thing. So I was there and I felt the earthquake, the noise and everything. I went through that, but I went out of my room and I was physically safe, but psychologically shaken, as you can imagine. And basically, after I realized that my family was safe, I was called to. I went to my aunt's house, and somebody came and asked if I could go to an orphanage and give some help to people, because the medical system, the medical care facilities were totally overwhelmed. The third day, the second day post-earthquake. And I went there, and since I arrived there, the first day I arrived at 4 p.m. in that orphanage, I found in the courtyard of the orphanage, a small courtyard, 30 patients with major injuries, mostly limbs injuries, a lot of pelvic fractures. Those people also were, terrified by what they have lived through, and a lot of psychological distress. We start to take care of patients basically, and we had 30 patients waiting in cars or taken to the center, but they couldn't go in.
And they were waiting in their cars?
They were waiting in their cars, and we had to go outside and evaluate them and see which patient need to come inside first, so trying to triage.
Right, so you have to do the triage, who is the most seriously injured.
Exactly, triage the patients, and basically a lot of pelvic fractures, lying in cars, open fractures, infected at this stage, some of them because we're already at the second day post-earthquake, and those wounds were acquired under rubble, and they were heavily contaminated with a lot of sands, a lot of concrete, and also all the germs that live in the ground, in the soil. Basically, we run that makeshift hospital for about 4 days, and after 4 days, we were able to evacuate the patient to other facilities we think that we could provide better care for these patients. And we took care of about 100 patients there in 3 to 4 days, and we were working non-stop. And basically we didn't lose any patient.
Wow,
that was amazing to me. The problems are changing nature now. We are facing the first 2 weeks the really acute injuries, everything. Now you have those patients. What happened is most of the patient has left Port-au-Prince, because in 1 month you have 250,000 people who has left Port-au-Prince. You have going to the provincial town, and in Cap-Haïtien where we are, at least 50,000 people came.
Wow.
So we are facing it's like you have an accident, a head trauma. You have the coup in Port-au-Prince, and you have the contre coup happening in the provincial town. Instead of being focused, the problem is in Port-au-Prince. Now we have a multifocal crisis. And what kind of issue that you have? You have hunger. People haven't received enough food. I went to work. They had set up quickly refugee centers, and I went to work as a volunteer there. The main complaint of the patient in Cap-Haïtien that we are receiving, the victims from Port-au-Prince, was hunger. And besides that, we are seeing a lot of common medical problems. The major injuries were in hospital setting. They have their set of problems,
right,
because they need now prolonged wound care, psycho-emotional support, and physical therapy. We are looking at an integrated system where we can, in time, provide the appropriate care for those patients. We don't want to miss this opportunity.
This has been Damian McNamara, Global Medical News Network.